ANDEXANET alpha for the reversal of factor XA inhibitor activity. Definition, application in medicine, pros and cons, issue applied, conclusion. Definition. ANDEXANET alpha is a specific reversal agent that is designed to neutralize the anticoagulant effects of both direct and indirect factor XA inhibitors. ANDEXANET is a human factor decoy protein that is catalytically inactive but retains the ability to bind factor XA inhibitors in the active site with high affinity. ANDEXANET binds to the restoration of endogenous factor XA activity and to the reduction of anticoagulant activity levels. Continue the video.
Coagulation factor 10A plays a pivotal role in the final common pathway of the coagulation cascade. Factor 10A assembles together with factor 5A on the platelet surface, forming the prothrombinase complex, which is responsible for the large-scale conversion of prothrombin to thrombin. Inhibitors of factor 10A work by one of two distinct mechanisms. Small molecule direct factor 10A inhibitors, such as apixaban or rivaroxaban, bind to the active site of factor 10A and neutralize the catalytic activity of the prothrombinase complex. Indirect factor 10A inhibitors, such as enoxaparin or fondaparinux, bind to native antithrombin 3 and potentiate its capacity to inhibit factor 10A. ANDEXANET, an investigational drug, is a recombinant factor 10A derivative being developed for use as a universal antidote to direct and indirect factor 10A inhibitors. ANDEXANET lacks the membrane-binding domain of plasma-derived factor 10 and does not compete against native factor 10A in prothrombinase assembly on the platelet surface. ANDEXANET also features a serine to alanine substitution in the active site and a deletion of the heavy chain activation peptide that is present in native factor 10. Thus, ANDEXANET lacks pro- or anticoagulant activity on its own. The mechanism of action of ANDEXANET is based on its capacity to function as a decoy factor 10A molecule. ANDEXANET binds to direct factor 10A inhibitors with high affinity, sequestering the inhibitor and thus rapidly reducing the free plasma concentration and neutralizing the anticoagulant effect of the inhibitor. ANDEXANET also binds to and sequesters molecules of antithrombin 3 that are complexed with indirect inhibitor molecules, disrupting the capacity of antithrombin complex to bind to native factor 10A. Currently, there is no effective antidote for reversal of factor 10A inhibitors, especially the direct factor 10A inhibitors, the uptake of which is increasing.
Application in medicine. The direct factor XA inhibitors apixaban, rivaroxaban, and endoxaban are used in the prevention and treatment of thromboembolisms. For the use of these agents include the prevention of stroke in patients with non-valvular atrial fibrillation, the treatment and secondary prevention of deep vein thrombosis and pulmonary embolisms, and the prevention of venous thrombosis after orthopedic surgery. Continue the video.
Factor 10A inhibitors such as apixaban and rivaroxaban are convenient to take but can cause bleeding complications. Many physicians hesitate to use them because there's no easy way to reverse the effects of treatment in the event of an accident, internal bleeding, or a surgical emergency. ANDEXANET is a fragment of factor 10A that was designed to rapidly reverse the anticoagulant effects of these inhibitors by preventing their binding to authentic factor 10A. To test the efficacy of ANDEXANET, a small phase 3 trial was designed with healthy older volunteers as the participants. They were given either 10 milligrams of apixaban or 20 milligrams of rivaroxaban daily until steady-state anticoagulation had been achieved. Then intravenous ANDEXANET was given to determine whether the effects of these anticoagulants on blood clotting could be reversed, and if so, what the side effects might be. The primary outcome was the mean % change in anti-factor Xa activity, which was significantly reduced both in participants who received a bolus of ANDEXANET and in those who received a bolus followed by an infusion of the drug. Participants who received a bolus of ANDEXANET had fully restored thrombin generation within 2 to 5 minutes, and this effect was sustained while ANDEXANET was given as an infusion after the bolus. No serious adverse events were noted. The authors conclude that ANDEXANET reversed the anticoagulant activity of apixaban and rivaroxaban in healthy older volunteers within minutes and for the duration of infusion, without evidence of clinical toxicity. Full trial results are available at nejm.org.
Pros and cons. Pros. Therefore, it appears to be an effective and safe inhibitor should be needed by bleeding in patients treated with apixaban and rivaroxaban. ANDEXANET alpha was well tolerated with no serious adverse effects were noticed. Cons. In patients with acute hemorrhage, it is difficult to determine its possible complication, such as thrombosis or death, are related to the reversal treatment or the underlying medical illness. Continue the video.
I'm Peter Block with the Cardiosaurus Heart Minute, and today I'm with Chris Cannon. And we're talking about some of the new stories that have come up in the last couple of weeks that are of interest. One of those is a story in JACC, which concerns a comparison between the thrombin inhibitor dabigatran versus the anti-10A agents apixaban and rivaroxaban. This was an indirect comparison, and it's really difficult to understand with all of those comparisons in the previous trials exactly what kind of a conclusion, I guess, is you can reach with this. So they tried to put together all of these three agents and compare them against warfarin. You wrote an editorial on this, Chris. What's your take on this?
Well, it's a very hot topic, obviously. We have 3 new drugs. Each trial showed benefits over warfarin, and so we then are asking, well, which one of these should we use? And so it's very tempting to compare to that one common denominator, the warfarin. I think what's clear is that each of them has advantages, but when comparing one agent to the other, the problem is that the trials do have differences between them. So some have patients with very high CHADS risk score, others have the full range. There's also differences in how the warfarin was managed, with differences in the time of therapeutic or time in therapeutic range of the patients in the warfarin group. So you can't attribute all of the difference seen relative to warfarin to the new drug. Some of it is the control group in the population.
Right. It looks to me like probably we're still going to have to wait for direct head-to-head comparisons between these agents. I doubt, candidly, that will ever be done. But until then, we'll have to do the best we can, probably going back to the original studies. Wouldn't you agree?
Exactly. I think, these are all large trials, and so each of them individually provides us with very good evidence for what the efficacy and safety is in preventing strokes. It's often less bleeding, certainly fewer hemorrhagic strokes. So I think some real advantages of the new agents, but relying on the individual trials is probably the right answer.
So good agents, but the jury's still out, and we'll just have to wait and see. Thanks.
Issue applet. ANDEXANET alpha is a recombinant premium in class. Modified molecule factor Xa, spanning countries like Argentina, Chile, Peru, Colombia. Continue the video.
Thrombosis.tv coverage continues at the 2015 ISTH conference in Toronto. I'm Thomas Baldrick, joined now by Polly Pine. She is the Senior Director of Pharmacology at Portola Pharmaceuticals. Thanks for coming by and spending some time with us.
Thank you, Tom, for inviting me.
What can you tell us about this research you have?
Okay, so we have been testing ANDEXANET alpha and 4-factor prothrombin complex concentrates in an animal model. These animals were anticoagulated with rivaroxaban, and we induced an injury, a liver injury, in these anticoagulated animals, and then we treated them with either ANDEXANET alpha or Kcentra. And we used therapeutic dose levels of each of those agents, and we measured blood loss, anti-factor 10A activity, prothrombin time, the unbound anticoagulant levels, the total anticoagulant levels, and also we calculated the stoichiometry of ANDEXANET to total rivaroxaban needed to completely reverse blood loss.
Polly, how can your primary endpoints be interpreted?
We saw complete reversal of blood loss at therapeutic doses of ANDEXANET, whereas we really did not see any change, a substantial, significant change in blood loss in animals that were treated with Kcentra as an antidote. And as far as the pharmacodynamic endpoints, anti-factor 10A activity was reduced back to baseline levels when the animals were treated with ANDEXANET, but there was really no change when the animals were treated with Kcentra. And similarly, the prothrombin time wasn't changed. The anticoagulant levels that were circulating systemically were not changed with Kcentra, whereas ANDEXANET alpha reduced the unbound rivaroxaban levels to very, very low levels, 3 nanograms per mil, while they increased the total rivaroxaban levels as there was a shift from the extravascular compartment to the vasculature so that the anticoagulant could be eliminated. So I think the interpretation is that the ANDEXANET alpha is able to completely reverse the effects of the anticoagulant, while Kcentra has no effect, no significant effect on reducing blood loss or any of the pharmacodynamic markers in this model.
What's next for ANDEXANET?
Okay, well, ANDEXANET is in phase 3 trials, and Portola has just initiated a phase 4 trial in bleeding patients, and the intent is to file a BLA by the end of the year, so hopefully this will be available for patients before long.
Keep us updated, would you?
Okay, thank you.
Polly Pine, thanks for your time. We appreciate it. Good
Okay,
luck.
thank you.
Conclusion. In conclusion, ANDEXANET is a specific rapid acting antidote that is being developed for the urgent reversal of the anticoagulant activity of the factor XA inhibitor. The reversal of anticoagulation with ANDEXANET was not associated with safety problems or thrombotic effects. The ability of ANDEXANET to reverse the anticoagulation markers in participants undergoing anticoagulation with apixaban, rivaroxaban, endoxaban, or enoxaparin made it a potential and universal antidote for direct and indirect factor XA inhibitors. Continue the video.
It is our pleasure to be joined by Mark Crowther, MD from McMaster University in Hamilton, Ontario. Thanks for coming south of the border and joining us.
Thank you very much. It's a pleasure to be here in New Orleans.
Let's talk about this phase 2 study that you've presented data for here.
Right, so the study looks at the use of a new medication designed to reverse the effect of some of the new anticoagulant agents. Over the last 10 years, there's been a lot of work done to design and implement new blood thinning medications for patients, and one of the limitations that's been observed is that there's no effective way of reversing them. This new product is designed to specifically reverse the effects of the blood thinning drugs. Patients who are bleeding or patients who need surgical procedures can receive these medications, and when they receive them, it increases their risk of bleeding. This drug is designed to counter that effect and to completely stop the blood thinning effect.
How did you design this study?
The medication was designed by a company called Portola. The product is called ANDEXANET alpha, and it's designed using our knowledge of how the blood clotting system works. It takes a molecule called factor 10, it's changed it chemically, and that chemically changed factor 10 molecule is able to bind to and inactivate these new blood thinning medications.
Mark, what do you think the key findings are of this?
The key findings are that this medication is able to almost instantaneously and almost completely reverse the blood thinning effect of these drugs. We do find patients come in bleeding on these medications, on these new blood thinners, and by using this medication, we hope to be able to completely stop that component of the bleeding that is due to the blood thinning medication through the infusion of this new product.
What are your observations on using this for future patient treatment?
We will need to develop a program for implementing this in bleeding patients. Bleeding patients can come into the hospital at any time of the day or night, and this is the kind of medication that when it's shown to be effective in all possible kinds of patients, that we hope to have available in emergency departments so that the bleeding patient can receive it promptly and have their bleeding effect completely reversed quickly and efficiently.
You really feel like you're onto something unique here.
This is a unique product. At present, there is no effective way of reversing these medications. The medications that we're reversing are widely used in medical practice in the United States and elsewhere in the world, and today there is no effective way of reversing their effect.
Very good. Thanks for joining us, and best of luck going forward.
Thank you very much.
Very good.